Hi, I'm Dr. Michelle Paris, and I am the clinic director here at the Poppy Clinic. And today I wanted to talk to you about 7 essential blood tests you need to advocate for thriving health. So as women, we crave to feel well, and we are curious to figure out what it is that's going on. And for a lot of us, we've been getting the feedback that things are fine, everything looks okay. But what is fine? Fine is a really low standard of healthcare. What is optimal? So today we're going to learn about what tests you need to ask for and why it's so important that you work with a naturopathic doctor to figure out what thriving health looks like. So it's fine that you fall within a reference range, but what does that mean? Reference ranges are often looking at the population as a whole. And so if the population isn't overly healthy, you want to fall in the middle of that. So we really want to help you understand and how to interpret these tests efficiently so that you can transform your health. So test number 1 is a complete blood count, a CBC. This looks at your red blood cells, your white blood cells, and helps give us a picture of, do you have enough iron? Are you low in B12? Is your immune system challenged? Are you getting sick all the time? So this just gives us a nice overall picture of what's going on with your blood. The next test is B12. Vitamin B12 is essential, and it can be incredibly hard to absorb. And so we want to look at this number, and it has a really wide reference range. And for a lot of women, they may fall in that range, but they're way too low to feel energized and mentally clear in their life and ensure that their nervous system works. So this is a really important number that you need to request. Our next test is ferritin. Ferritin is the storage form of iron, and this tells us how well your body is absorbing and utilizing and storing iron. And when we put ferritin with that CBC, that complete blood count, we can actually see how well your body is converting that iron into hemoglobin. Women often run into a detriment of low ferritin because of monthly menstruation. So this is a number that you need to know on an annual basis. And if you are low in iron, you should be checking this at least 1 to 2 times a year to see if you're absorbing, how your supplement is working, how's the nutrition style you're working on working for you. So it's really important to understand that number. Our next number is, our next blood value is the thyroid panel. Now your doctor's going to run a TSH, a thyroid stimulating hormone, but that tells us so little about thyroid health. So when you're advocating for yourself, you want to ask for the entire thyroid panel. So TSH, T3, T4, thyroid antibodies, anti-TPO and anti-thyroglobulin, and reverse T3. And through all of those values, you will learn how well your thyroid is functioning. When we're talking about energy, mental clarity, mood, weight management, thyroid is essential for everything. Every cell in the body has a T3 receptor. So it's so important that we understand the whole picture. Our next test is vitamin D. We live in Canada, we live in Ontario, and it is very gray here. So it is often underutilized as a test. I'm not sure we understand the gravity of vitamin D deficiency because everyone has to pay out of pocket for this value. So you need to check in on this once a year at minimum, recommended maybe twice a year if you were deficient. The best time to test is in February when our stores are the lowest, when it's the grayest, the longest, to check in on how are your vitamin D stores. When it comes to mood, hormone production, immune health, cancer reduction, bone health, vitamin D is essential. Next on our test is fasting insulin, and I will pair that with the last test, which is fasting glucose. Insulin resistance is a concern many of us face. It's becoming a global health concern with the propensity for the population to be overweight and obese. what ends up happening is there's this dysfunction between insulin and glucose, and our body becomes resistant. And so before an individual is diagnosed with type 2 diabetes, you can actually run values like fasting insulin and fasting glucose. And we can plug that into an insulin resistant calculator for you and let you know your 10-year risk of developing type 2 diabetes. Alzheimer's and dementia is now being listed as, or named as, type 3 diabetes. So much of the chronic health issues that we face, inflammation, stress, chronic disease, and cancer rates all increase when our blood sugar levels are not balanced. So having a good idea of where you sit in terms of your blood sugar management is essential for thriving health. So when you speak to your healthcare provider or your naturopathic doctor, please advocate for these 7 tests on an annual basis to check in. If you want abundant energy and mental clarity and thriving health, these tests tell us so much information. And often we blame a lot on our lifestyle and other things. If you are truly deficient, these are correctable parameters to ensure that you thrive in your health and that you can reclaim so much of what is holding you back from living your best life. So now you know the 7 essential tests that help you reclaim your vibrant energy that you absolutely have the capacity to achieve. So go speak to your naturopathic doctor or your functional medicine doctor about how to best get these tests and have them walk you through the results. What is optimal? Where do you need to go? What do you need to focus on? Often it's much simpler than we make it. We can overcomplicate it with saying this stress is getting in the way, this is getting in the way. If you are just depleted and deficient in micronutrients, then it is so solvable, and your best self is just around the corner. So go get those tests run.